Hello, and welcome to my talk. My name is Charles Makel, and I'm affiliated with Argonne National Laboratory. Today I'll be talking about city-scale hybrid simulation modeling of COVID-19 spread. Hello, everyone, and welcome to my talk, which will be on city-scale hybrid simulation modeling of COVID-19 spread. And thank you for coming. Okay, this is continuation of work that I've done on COVID-19 modeling from the past year, and I did present some of the early kind of modeling approaches and results last year at this conference. And so I'm very happy to present further extensions and focusing on how we could do this kind of modeling in using Mathematica. Last year was more of why we would want to do it. This year is how we go about doing it. So there we go. The key question is, how can we model disease spread in a city population and the actions and behaviors of people at scale? So this is not a toy model that we would like to develop. We want to actually model an entire city of millions of people and the processes, the mechanisms for disease spread throughout that population over time. Why would we want to do this? Well, we want to provide forecasts of disease spread, which include uncertainty ranges because we can't predict the future. And we want to provide this information to decision makers in real time, meaning when it's in time for them to make the decisions that they need to make, and the information is still relevant. And we want to understand the possible effects of interventions that decision makers might take to mitigate the spread. In this case, COVID-19. I've worked closely with the city of Chicago and also with the state of Illinois decision makers, the departments of public health, not necessarily using this model, but a precursor to this model. But the after effect is to want to do it right for next time. And Mathematica is a good option to do that. Of course, next time is still this time when it comes to COVID-19. So who knew, but 2.5 years have gone by. The questions are still arising. The modeling is still relevant and the decisions still need to be made. A quick background on epidemiological modeling. There's basically three kinds of such models. There's statistical models, which are very aggregate and just kind of are processing data. A good example is the IHME model, the national model, which you've probably heard about. It produces the most, let's say, popular forecasts of COVID spread coming up. But the two kinds of models that I want to focus on are what they call compartmental models, where the population is divided into compartments based on the disease states of the people, so to speak, or the population segment, I should say, in that compartment. And there could be possibly other characteristics. So you might have compartments that are disease state and age, maybe sociodemographic characteristics as well. These are typically what's called the SIR model, the SEIR model, which is essentially a differential equation model. It's the traditional way to model disease spread, where the different disease states are included, such as S meaning susceptible, E meaning exposed, I meaning infected, and R recovered. The basic model is SIR, but SEIR, where there's an exposed state in between, turns out to be, much more widely applicable. And there's been many COVID models that are in the SEIR, let's say, category, as well as the flu models and things like that. But the third kind of model, which is kind of a new wave of modeling epidemics, are called, mechanistic models, and in particular use a technique called agent-based modeling. In an agent-based model, you represent all individuals in the population as individual agents. So, for example, in Chicago, there's 2.7 million people, which is actually the focus of my application here and talk. And so you'd have 2.7 million agents in the model. And so that's a lot of agents. Agents have like characteristics, could be their age, as I mentioned, socioeconomic characteristics, et cetera, where they live by at least zip code level. They also have behaviors that we can attribute to the agents, kind of like methods on top of, instantiations of objects, kind of think of it like that. And agents also have, in this context, of course, a disease state. Okay. So people ask me all the time about agent-based modeling. They say, well, show me the equations in your agent-based model. And, there aren't any. Like Stevens was talking last night, all we have is programs. There are no equations in an agent-based model. And so this is roughly what an agent-based model looks like of a city. You have what I would term agents, which are virtual people. They are at places such as households or hospitals at any particular time. That is, they're at places, workplaces, school. They're somewhere at any time. And in an epidemiological model, you want to simulate the contact people these agents are having with each other as time goes on, because contact is the primary mechanism, so to speak, for disease spread in an infectious disease model. Also, as I mentioned, agents have behaviors. They might engage in certain activities that are more prone to transmitting disease. They might wear masks or not. They might decide to get vaccinated or not, et cetera. So basically, the basic idea of modeling disease transmission is to take persons, places, and activity schedules and combine these three things together, because that establishes people's movement or mobility patterns according to some schedule. And in this case, it's very important to have fine-grained temporal resolution. So we do it by hour, but one could arbitrarily go smaller if one needed to. And so people then are having are being co-located at specific places, and that leads to contact. That contact then is a kind of precursor to transmission, as infectious individuals in the population are, with a certain transmission probability, transmitting, well, in this case, COVID-19, to people that are in the susceptible state in particular, okay? So whether you have a differential equation model or an agent-based model, these are the mechanisms that you're modeling. With a differential equation model, compartmental model, you're just modeling at a very aggregate level of the population. But at an agent-based model, you're modeling each individual. And that gets us to how we model the progression of a disease. Now, I didn't have time to, fix the font here, but basically, this represents the flow chart of disease state transition for COVID-19. It's at a fairly fine-grained level. It starts on the left. People are susceptible. Then there's an exposure rate, which causes people to get exposed and eventually become infected and infectious, which ultimately, in the case of COVID-19, leads to people who are infected asymptomatically on the top, or pre-symptomatic, and eventually will become symptomatic. As you know, probably the biggest factor with COVID-19, which makes it so problematic, is that so many people, up to 60% of people who have COVID-19, don't display any symptoms whatsoever. So they don't know they're transmitting the disease to people. Anyway, so moving, right kind of through this chart, there's, probabilities of one ending up in the hospital. Let's say the branching that goes on here, the rates are based on real data. So, if there's a 40% chance or whatever you could be symptomatic, and 60%, and that is collected as we went through the pandemic, and it's shifted a little bit too. So in any case, as we move through this diagram, people might become hospitalized. They might require an ICU unit or even a ventilator unit. And those are all, like, let's say, fractional branching probabilities based on real data, which is attributable to the sociodemographics, including age of the particular individuals. And eventually people either recover or they end up being, in the deceased box. So this kind of state transition diagram is applicable at both the entire population, where each box here in a compartmental model is a compartment and has one differential equation associated with it, or this same diagram is totally applicable at the individual agent level, where the agent state then would be essentially, the label on each box. Okay, so people move through this progression over time. Anyway, there's something called system dynamics. It's a form of modeling. It's basically difference equations. If you're in the simulation, it's a well-known technique. And what this shows is a systems dynamics compartmental model of COVID-19. So what you can see here are the difference equations. Let's pick out a good one here. Exposed. No. Here we go. I'm looking, okay, so basically, this is people in the asymptomatic state, this equation, and it's basically saying the people in the asymptomatic state at time t are equal to the people that were in the asymptomatic state at time t minus 1, plus the rate of change of people who are continuing on in that state. This is just basic how you model flows through compartments. It's kind of 1 over the duration is the rate, right? So you have it's like a bathtub model, right? You've got water in the bathtub, and you've got the rate of water going down the drain. That's the out. And then you've got the faucet putting water in, that's the in. And it you just take a snapshot every, one time unit, and you update it that way. So anyway, I just thought I'd show you this, but the very interesting thing is it's very easy to enumerate new kinds of compartments. So in this case, the asymptomatic, let's say, compartment is indexed on time, but it's also indexed on age or race and ethnicity and zone or actual zip code where people live. So this effectively models an entire additional layer every time you put in another attribute that could be very important for modeling. The reason this turns out to be really important is because transmission rates and everything else are dependent on age. They are dependent on race and ethnicity, as well as other factors. And this kind of addition allows one to do things like model like underserved populations in a different way. We call them underserved populations now. And we know there's disparities in how the COVID-19 pandemic let's say, unfolded for various reasons. Anyway, so this is pretty cool, I think. But anyway, that's kind of the model setup, and that was just like one, program, quite compact. And to actually run the model, we just time-stepped using a table through the days in the or the times in the simulation, where time could be by day or it could potentially be by hour. But for the most part, these differential equation models, we do them by day. So that's the entire structure of the model. So what do you get out of a model like that? Well, remember all those boxes were states. And so here we're doing a simulation for actually from the very start of the pandemic of March in 2020. And this goes through the end of August 21st. And every single state, then you see the profile. And these are essentially the exact profiles of what occurred in the city of Chicago, because we had instrumented it with the real data coming from the field at the time. And then simulated the in-between parts for which we didn't have the data for. So, and this is the little layers there are, I think those are by age groups. So we could see which ages are most effective. This is the kind of thing public health decision makers really want to know about. What's going on out there? Are there disparities? And we can see the first peak here, first giant peak. There's been several waves of COVID-19, as you know. I don't know if we're on the 5th or 6th one right now, but the national models say more will come soon. Anyway, so that's a compartmental model, and an agent-based model is a little more, I guess you'd say, more complicated. First of all, you have to develop an actual synthetic population. But developing a synthetic population is really as simple as 1, 2, 3. 1, you need a synthetic population of persons. 2, you need a synthetic population of places. And 3, you just need the activity schedules that people would actually go through during the course of their day, because that links time to the places they need to be at for those activities. So the second thing you would do is to simulate the synthetic population, let's say over a 4-week period, as people move from place to place, let's say every hour, according to their daily activity schedules. And as I mentioned earlier, that results in co-location. So you got a bunch of people at the same place, a bunch of people in the same school, a bunch in the same workplace, a bunch at home. And that co-location then allows us to model disease transmission from infectious individuals who are in an infectious state to individuals who are in a susceptible state at that place. So the outcome is the diseased states are kind of transition potentially for a certain probability-based fraction of the population of agents. So, it's interesting how you model this, because we have in the model, as I said, there's 2.7 million people, 2.7 million persons. And one of the things that was helpful and really necessary to do was create like the data structure for person. And this is what I call the person pattern, age, sex, race, Hispanic or not, et cetera, income, household size, et cetera. And, persons are modeled as associations, thanks to some advice I received from Lou D'Andrea a couple of years ago. Everything's an association. So one can query like a person, like this is person number 5,444,303, and just show all the attributes that make up that person. These are static attributes, okay? So there's all kinds of things like schedule lists, places, restaurants. A person might go to, in this case, 5 possible restaurants. So on any given day, we're randomly selecting which restaurant they might go to. And those restaurant possibilities are based on location and basically factors like that, right? So, this generally indicates the places that are really important that people move around to. This person doesn't have a school ID, so they don't go to school, but they are 28 years old, a male, white, not Hispanic. Oh, this one makes over 100,000 a year. Household size. We know a lot about people. By the way, these are, kind of the data comes from, there are synthetic populations that are like commodities out there. You can, download them from the internet by zip code and things like that. Then we have to supplement them according to our particular location. That's hours of more, discussion if people are interested in how you make synthetic populations. Same thing with place. Here's a typical place. Not a lot of attributes, but we know the type of place. We know the latitude, longitude, zip code. Let's see, census block group, stuff like that. Oh, by the way, this one's name, this is place 1,378,035 is the Handsome Bakery and Amp Cafe. And so these are real places in Chicago, and these are all the places in Chicago that have addresses or locations. We know the, location, all that stuff. It's a lot of work to create these synthetic populations. And again, schedules. Here's a typical schedule. There's 12,000 schedules altogether. And, we associate a schedule, which is associated with the socio-demographic attributes, to people that have that socio-demographic. So they choose, or we assign a schedule. And this is all based on, data from the American Time Use Survey, the American Community Survey, all that stuff. Actually, we've been working on this part for many years. But in any case, here's a typical schedule where 0 is midnight for a given day. And so at midnight, this person is in their household, and they don't leave their household till 2:30 in the afternoon, where they're engaging in some kind of recreational activity. And then they are out of the house until looks like 7:20 that evening in the household. And then they just stay there for the rest of the day. So what happens is when we create a schedule for a person for a given day, we replace these strings here that say household or whatever by a real household ID, a real place. So that varies every day. So let's see, I have 3 minutes, 21 seconds left. Anyway, yeah, summary synthetic population. Here's, all those, here's examples of schedules and places and persons, but I mean, this is millions of people versus millions of places versus, tens of thousands of schedules they are, operating under. Okay, so let's see, what else do we need to tell you? All the people and everything I showed you so is static, but in a simulation, things change over time. This is the dynamic part. So you could call these dynamic attributes. But what, the kind of things we need to keep track of are the disease state of each individual, the location of each individual, the daily schedule, which could change, and the vaccination state, for example, of each individual. Let's see here. And so we model those by events. So if you're familiar with simulation technology, this is what we call a next event, discrete event simulation. Okay, and the simulation advances through time by going from one event to the next event. Now, it turns out that there's a lot of events that occur every hour on the hour. So it's essentially a next event simulation that's equivalent to a time step simulation with the time step of whatever you want it to be in real time. Okay, so when an event occurs, it leads to often another event. So this is the event next event table. So in this case, if someone becomes exposed at time 43, this is an instance of what they might have for the next state. So they're going to be exposed for a certain amount of time. And then at time 310, these are in hours, by the way, that person will become asymptomatic. So the events are really lead to updates in the agent state. Okay. So we model all of that, of course, with associations. Why not? And so, I'm getting close to the end here. So it all fits together though, with simply what amounts to a loop, a time loop using table, which goes from, I call it T now to some initial time to a final time in days, and to some time increment, right? So very briefly, what it's doing here is it's figuring out place to persons. It just figures out, show me all the places and show me everybody that's at each place. And then the contagion model is applied that says, okay, for all these people at each place, we're going to apply contagion model to see who's going to get infected, right? And then after that's done, we have to update all of the states of the agents who are, who can be done individually. So like an agent might just transition to another state because it's been in the state for a long time. It doesn't interact with any agent. So we have to have this little mapping down here over all the keys of person, et cetera. And then we report, all the results like that. So, well, the results are basically, there's three kinds of results, and these again are associations. There is the state of every agent, okay, which is like the current state now, whenever the simulation, it's like the snapshot, whatever the simulation is. But there's also something that I call EVQ, which is the event queue. And so for a given agent, that's where all the upcoming events are. And the way the simulation works, it just takes the top event off and it executes that to change the agent state. Okay, so, mercifully, I'm coming to my last slide, but I do have bonus footage. In any case, so, okay, conclusions. There's enormous benefits from incorporating these two modeling paradigms together in one modeling system. And this is really at the state of the art of epidemiological modeling and where it needs to go, being, let's say, spun off from the COVID-19 experience and motivation. The challenge is to simulate 2.7 million or more persons moving hourly between 1.3 million places and having them interact at those places over an hour, hours for 4 weeks. So the computation time is an issue. To do that for the simulation, it's estimated the compute time would be about 15 hours. So I'm hoping to get some ideas here at the conference of how to cut that time down, because we can do a lot more simulations then. Anyway, so, this is bonus footage that even is not even included in the real presentation, but, and I'm sorry I didn't do this, but it's all based on the geocomputation aspects and the real dates and real times. So that clock's going around is getting, it's turning black and white based on today's sunrise and sundown times. And it is simply animating what the movements are as a result of the simulation. So if you like that, why not do it in 3D? So this is kind of the same situation, but now we're seeing for the city of Chicago, the occupancy of a bunch of selected places. Okay, so you can, if you're familiar with O'Hare Field out there on the far left, as you're looking at that little patch out there, it's appended to Chicago, just by the expressway. But you can see there's a really big occupancy spike over there, probably at the terminal, But anyway, this allows you to visualize things and might help in analysis, but it certainly is helpful to get the message across to decision makers as well.